Welcome, Dr. Cassie Smith. It's a delight to have you here today. We're going to talk about hormones and leaky gut and all kinds of great topics. And it's so nice to have you here because I think our stories are similar in that we were seeking in our undergraduate studies. Of course, you got a lot more schooling than I did, but I know I was seeking as an undergrad, as a registered dietitian, like, I just want to help people. I want to help people with nutrition. I want to help them heal. And I know that was your story too. And the underlying cause is like, why are people sick? Why are we dealing with these chronic diseases? And you felt like you weren't getting a whole lot of answers. So I won't give all your story away, but welcome to the podcast. We're so happy to have you here. If you could just start with your background, your story, and how you got. Now you have your own private practice called Modern Endocrine, and how you got on this road and where you are today.
Yeah, thank you for having me. So, yes, I think that we have a lot of similarities in the fact that I went into this field, with this like amazing ambition to make people feel better. And I, had this big dream of like, oh, I'm going to go to medical school and I'm going to learn all these things that are going to make people, want to change their lifestyle and be better and be healthy. And then after about 14 years between undergrad and, med school and residency and fellowship and all the training, I finished my training as an endocrinologist and I went to work for a private hospital. And like 6 months in, I'm like, my patients aren't getting better. They're actually getting worse. Like every time they come and see me, I'm giving them more medicine and they're gaining more weight and they feel worse. And it was just very like, I just had this moment like 6 months out of training that was just like, this is not what I thought it was going to be, And so I was very frustrated because I had this idea that as an endocrinologist, knowing how to treat diabetes, I did a lot of research with diabetes and I actually did a lot of research with, GLP-1s, which are a hot topic now. I actually did a lot of research with Ozempic in fellowship. And I thought, I have all this power and all this knowledge. I can make people with diabetes better. I can make them better. I can get them off medicine. I can make them lose weight. And that's not really what they teach you in medical school or traditional medicine. I found out the hard way. And I kind of, struggled for a couple of years in this big institution where I like my heart was telling me, this isn't why you did this, but my body was telling me like, you need to do this because you owe $500,000 in student debt. And at the same time, I had this, my own medical journey that I had kind of gone through, which was whenever I was actually in medical school, I got a autoimmune condition called Graves' disease. So my thyroid was overworking. And when I went to the doctor, it was basically like, sorry, you have this autoimmune condition. You can either take this medicine or we can just ablate your thyroid, meaning we can kill it. And I just thought that was very strange. There was no like, my question to the doctor was like, well, what caused this? Well, I don't know. It's just autoimmune. Well, is there anything I can do that isn't just, killing my thyroid or taking this medicine? Well, no. And I was just I didn't like that answer. I've always been a very intuitive person. Like, I want to know why. And so I kind of dealt with that in school and then kind of did some of my own research. Thankfully, I didn't listen to that doctor and ablate my thyroid. I took a medication called methimazole, which has its own issues, and then had some pretty bad side effects, but got through it and thankfully went into remission, and then ended up hypothyroid. So I ended up with Hashimoto's, and that brought around a whole other slew of issues. And while I was in medical school, I wasn't sleeping well, I wasn't eating well, obviously, not taking care of myself. I gained some weight, I had insulin resistance, I was told I had PCOS, just all these things were happening, and I'm like, why? And every time I went to a doctor, it was like, well, that's just, it's your life, it's your stress, it's your genes, it's, that's just how it is, take this medicine. And I looked back at one point and people were like, take metformin and take spironolactone and take levothyroxine, and like I'm on like 7 medicines, in my 20s. I'm like, what the hell happened? And so I just didn't like that approach that I got when I was a patient, but I was busy, right? I was in training and I didn't really know what else to do. And to be fair, I think, I looked up to these people, right? And I think this is where a lot of people, like, they're a doctor, they go to a lot of training. They are, I have a respect for people who know things more than I do, whether it be a doctor, a dentist, an attorney. I mean, I know that I'm good at my job, but I look to other people for guidance and things I'm not good at. And society has told us that doctors are, I mean, we go into medicine to help people. And so I just did what the doctor said, but internally I knew like something's not right here. And I just never got the answer that I wanted. And so I kind of made it through med school, made it through residency, made it through fellowship. But then when I got out into the real world and I started kind of reflecting and I was looking at my patients and also my journey, I wasn't happy. And I was like, there has to be another way, And so I just kind of started looking. Unfortunately, we didn't have Chat GPT in 2017. If we did, I would have figured it out a lot faster.
Yeah.
But like, I just wanted better answers. There was a time in my life where I thought I made a huge mistake in 2018 and 2019. I told my husband, I was like, I think I made a really big mistake. Like I spent years getting all this medical training and nobody's getting better. And this is not why I went into medicine. I did it because I really want people to heal and get better. And I want to, have that relationship with somebody to help them. And all I'm doing is I felt like a pill mill. Like I'm just giving them medicine and I'm giving them false hope and I'm pushing them out the door and I'm not making any change in their life at all. And so I had this really hard time right before COVID in 2020 where I was like, I don't want to be a doctor anymore. And it wasn't that I didn't want to be a doctor. It's just what a doctor was not what I thought it was going to be, And maybe it was that I was sheltered and I grew up in a small town in Lebanon, Missouri. I wasn't in a big city. I never went to the doctor. So maybe, so I just had all these doubts, like maybe I had the wrong impression of what a doctor is. Maybe so that's kind of what turned everything for me in 2020 was I got to this point where it was like, I want to do something else. I don't want to be a doctor. And my husband said to me, he said, well, first of all, that's not possible because you owe a lot of money. So you're going to be a doctor. But, he said to me, maybe Cassie, it's just the way you're looking at it. Like the way that you've, the situation that you're in, like maybe you need to change that situation or like the way that you're looking at it. And so I just started looking for different answers and that's kind of, it's evolved, it's a long story, but in 2020, I had Hashimoto's. I had insulin resistance. I had PCOS. I was having fertility issues. In 2020 and 2021, I had miscarriages. I was just seeing all these doctors and I'm an endocrinologist. Like I'm supposed to be, I also kind of felt like a failure. I'm supposed to be this person who knows the answers to all of this. Right. And I'm like clueless and I don't feel well and I'm gaining weight. And for God's sakes, I can't even have a baby. Like this is ridiculous. And so it just put me down this path of like, there's got to be better answers than just, that's just how you were born. Those are just your genes. Just take this medicine. And so I just got to a pretty low place in 2020 where I was like, okay, something's got to give. And so I started looking into functional medicine and I just started teaching myself about things for myself. And I really leaned into my gut and some other things, which we can talk about. And I started getting better. And so then it was at that point that I knew like I need to divorce traditional medicine and I need to figure out how to treat people, the way that I'm learning for myself. And that actually makes people better.
Yes. It's so frustrating because it's all in the training. And so you were trained how you were trained and you get, like you said, looking up to these doctors and a lot of pharmacology. And I've had many, many doctors on here and say like, we got like 2 hours of nutritional therapy in school. And even as a dietitian, my story is so similar to yours. Like I was getting frustrated too, because even though I'm teaching nutrition and medical nutrition therapy, how the conventional guidelines are set up and people are coming to me to once they get diagnosed with type 2 diabetes and they're not getting better from my guidance either. And I'm like, and I'm trying, and I'm teaching them nutrition, but I'm teaching them the conventional guidelines that are not designed to reverse disease processes. So same thing, like I left, I'm like, I don't want to be a dietitian anymore. I can't do this. And I wasn't feeling great. So I left the field for like 5 years, did deep dive into so many different avenues. And my son was diagnosed in 2016 with ulcerative colitis. And that's when I left. I'm like, because same thing, like we take them to these doctors and I know a lot about gut stuff since then, because I did so much studying on it. But at the time I was like, well, why did this happen? Like he was not sick 2 weeks ago. Oh, it's just an autoimmune thing. Just It's just
Yeah.
how it is. But why? Like why? Like I just why? And they hate people. They hate people like moms like me who are like, but I don't understand. Like he was well 2 weeks ago, and there's nothing except tiers of medications and tiers of medications that go into classifications of chemotherapy. And I'm like, nope, like we're gonna figure this out. So yeah, so your story is very unique, but common at the same time. So what do you think it was? So it was first hyper, like Graves' disease, so hyperthyroid that you were dealing with. And I'm sure it's a compilation of a lot of things. I mean, you're in med school, you're
Yeah.
not sleepy and so much stress. But then it like transitioned to hypothyroid. And I think that that's very common too. And correct me if I'm wrong, but what do you think was happening in that time where first it's hyperthyroid and then it went to hypo, and how you started to correct things?
Yeah, and to be fair too, like I don't mean to make traditional medicine and doctors out
Right.
to be like terrible people. So I do want to say that. Like I think that people go into medicine for the right reason.
Yeah.
It's not easy. It's you sacrifice a lot to be a doctor, mentally, physically, and emotionally. I think it's an education problem though. It really is. And to your point, like in medical school, you learn these compartmental things about the body, but never did I have somebody stand up and be like, let's put all this together. And I never had nutrition counseling, which is insane because I say this all the time. Even Hippocrates, 2,400 years ago, let food be thy medicine and medicine be thy food. Like he knew more than a lot of doctors know now how important it was. And so I just think it's a huge training issue. And then when you get into the world, right, as a doctor, whenever I worked for Mercy, I had 15 minutes to see a patient and to talk to them about their diabetes and their blood pressure and their cholesterol. And did they get their colonoscopy and their mammogram? Like it's too much to do. And so to be fair, it's just doctors are put in I don't think doctors are put in a place to succeed, unfortunately. And so I just want to be fair in saying that my hat is off to like all the providers, everyone who is a doctor who selfishly, gives up their life to do that education and training and take care of people. It's really hard. I've done it. But it's a training issue. And so I think what happened, to answer your question about the Graves, it is very common to have an autoimmune condition like Graves and then it switched to something else. So Graves to Hashimoto's, I see a lot. It's pretty uncommon to go from Hashimoto's to Graves, but it can happen. And so when I got diagnosed with Graves, there are antibody tests that you can do. One of them is called a TSI, a thyroid stimulating immunoglobulin. Mine was high. That's how I knew I had Graves. But I also had a high TPO antibody. So I had the antibody that can cause Hashimoto's as well. I think what happened now, looking back 20 years ago, was the perfect storm, right? So I grew up pretty healthy in general. I mean, I'm not saying like I ate candy, but I played outside. So like we didn't watch a bunch of TV. Like we played outside. We were in the sun. My mom cooked meals at home. My grandma cooked. Like I had a pretty, in general, healthy childhood. I had some stress as a child, which I think had played into it, like some just built up stress. But then what happened was this like environment as a kid that you have at home, right? You have your parents, you have just this whole environment. When you kind of go to college, that's a big shift in your life, right? Like you no longer have your parents making your food and it's a big shift. And so I went away to college 3.5 hours away. Now I'm like on my own. I'm supposed to make my own food, do my own laundry, make my own decisions, go to class, not go to class, figure out whether I'm going to class or whether I'm going to a party or, it's a lot. And so you get thrown into this whole different environment. I did not make good food choices because whenever I was stressed and studying a lot, I'm the type of person who just doesn't eat. And then I would be starving and it's 2 o'clock in the morning. So then Taco Bell is like right down the street, right? And I'm also in college. So you can get 6 bean burritos for $6 and a giant Diet Coke. So, I mean, it was a lot of things, right? It was the environment, it was the food, it was the lack of sleep. It was, I stopped exercising. So it was just, I wasn't taking care of me. And that was like the perfect storm. I had this genetic predisposition. I'm not doing what I'm supposed to do. And so your body will tell you that it doesn't like your decisions in the form of symptoms. And so that's what happened, right? So when you have Graves, like my hair started falling out. I was really hot. I couldn't sleep. I started losing weight. I had diarrhea. sweating profusely, my heart's beating all the time. Like my body was like, hey, yo, you need to sleep, you need to drink water, you need to eat. I chose not to do that though, because I was in school and they don't teach you to be very nice to yourself in school, right? It's like you need to study, you need to take care of patients. And so I think it was just this perfect storm. And then whenever I got treated, I go to this doctor, instead of this doctor saying to me, like, well, let's talk about your life, it was just like, well, you need to ablate your thyroid. And they said that to me because they were like, well, you're in school and this is going to cause you symptoms and you're not going to be able to concentrate. Like, that's why I really went. I knew something was wrong, but like I couldn't concentrate. I remember sitting there trying to study and my heart was beating so hard. I couldn't even like think or read because I could just feel like this. I thought I was going to die. And so the doctor said to me, well, if you don't want, your school to be affected or your life to be affected, let's just ablate your thyroid and be done. And to me, that was it was so crazy. And so doing a little bit of my own research, what I decided was to take this medication that blocks your body's ability to make thyroid hormone. So it's not a perfect fix, right? But what it does is it will block your body's ability from making all that extra thyroid hormone, maybe like half of it, or block 75% of it. It depends on how much your thyroid's overworking. So I chose to take that medicine to a point where it blocks it enough that you're kind of normal, per se, although that's not normal either. And I didn't change my life. I didn't change anything. I still was staying up till 2 a.m. studying. I was still eating poorly. I was just all the things. Those medications that block your thyroid like that, though, I think what happened knowing now is like my gut was in a bad place too. My adrenals were shot, right? So your adrenal glands are very important with your thyroid. My gut was in a terrible place. I know I had leaky gut. My stomach hurt all the time when I eat. I used to not eat because my stomach hurt. So I would tell people, like, people would be like, do you want to, like, I even remember whenever I was little, sometimes I had an allergy to dairy, I'm pretty sure, as a child, and nobody could figure it out. But I would eat and my stomach would hurt. Like I would have to go lay down and then I didn't want to eat anything. And so I think I had so many things going on, right? Between my thyroid and my adrenal and my stomach, that once we finally calmed down the hyperthyroidism with the medication, and I kind of went into this remissive state for a second where my thyroid wasn't just pumping out thyroid hormone, my adrenal gland was shot at that point. It was like, I'm done making cortisol for you. You're running 100 miles an hour and you're never taking a break. And my gut was leaking from all the bad food I was eating, which was causing more inflammation. So then my thyroid just stopped working completely, And so I think that's the problem with autoimmune conditions, is when nobody's looking at the big picture, they're just looking at your thyroid, or they're just looking at your skin, or they're just looking at your son's colon. They're missing so many things, right? Because everything is connected. And so then that's how I ended up with Hashimoto's. And then I know that my gut issue and the fact my thyroid wasn't working and the fact that my adrenal wasn't working is what caused my insulin resistance and my PCOS. And it caused my hormone issues, because all those things go together. And then, years of that, we're talking like 10 years probably, of poorly treated Hashimoto's. It makes sense that then whenever I am well enough to actually have a menstrual cycle and actually have periods, because I didn't for years, that they're probably not going to be successful periods and pregnancies and births when you haven't even had a period in 10 years and your body is still under all this stress. And I didn't even know at that point I had leaky gut, right? This was before I even had looked at my gut. So just all of these things, like, this is what I want people to understand and be an advocate of, is like, all of these symptoms that you're having are all kind of feeding into each other and making things worse.
Yes. And a lot of times people just think they want to compartmentalize all of the symptoms, but and then I just have this one hormone that's out of balance, and it's like, no, it's a network and a symphony of everything that's interconnected, and if we don't fix the actual leak where it started, it's just going to keep exacerbating. But I honestly, like, I have a special place in my heart for college students, because that's when my issues started for sure. Like, I know I can trace cortisol issues back to college. I was puffy. I had skin issues. I was 2 sizes bigger than I am right now, even though I was exercising even more than I am now. And really crazy about like what I would allow myself to eat. And I know, like, my daughter went away to college too and lost her period for 6 months, like right off the bat. And we're just throwing these, I mean, they're children basically, like very young adults into a completely different environment. and the circadian disruption that happens, I think plays a huge role too. But yes, but thank you for sharing your story. And I would like to go back a little bit more because we do talk a lot about insulin resistance and adrenal issues. And I always tell people who have adrenal issues, like it's very intricately related to the thyroid. So can you talk a little bit deeper about, how the thyroid, the adrenal glands, and insulin resistance are so closely knit together, and how that they are interplaying in the body.
Yes. So I see this every day, and it's really sad too. And I'm sure you see this, but like, when you become a patient with me, we do this big intake where we do all these blood tests, like 40 blood tests. And then you sit down with me or one of my providers and we just explain it to you. And we have this big picture overview of like how everything works together. And it almost makes me cry every day whenever I do this with people. And people will just look at you and say, my doctor has done this blood work every year of my life. Why has nobody ever explained this to me? Like, why has nobody ever said this isn't completely normal, or this lab is why this is, causing these symptoms? And so it's really frustrating, but they don't teach us this in school. But to your point, your thyroid, your adrenal, your gut, I mean, those three things right there pretty much power almost everything. And the problem is that your gut is very sensitive to things other than just what you eat. So a lot of people will say to me, well, I eat really well, so I can't have a gut issue. Well, your stress and your sleep are just as important to your gut, maybe even more important than the actual food that you eat, right? If you're stressed, if you're not sleeping normally, if you're eating poorly, if you're eating things your body doesn't like, all of these things, and then your hormones, so your hormones actually play a part of your gut. So if you do have insulin resistance and your insulin's really high, whether that was genetic or self-induced by lack of exercise, poor nutrition, and or sleep, that high insulin level is very detrimental to your gut. Insulin is one of the most inflammatory molecules in our entire body. It is a potent hormone that is needed, but it's not needed in large amounts. And so there's 93% of Americans are walking around with elevated fasting insulins, in my opinion. So if you look at society guidelines, an insulin can be like 18. That is way too high. What happened was, several years ago, we realized that when you check people's insulin level fasting, nobody was 5 like they're supposed to be in America.
Especially in the hospital.
No, nobody was 5. And so what we did was we just moved the normal. Like, oh, well, nobody's normal, so let's just move it. We did that with liver enzymes. We did it with thyroid labs. That doesn't mean it's okay.
Right.
So, a lot of people say to me, well, why has nobody told me I have an insulin issue? Well, nobody has told you because technically you're in the range, but that doesn't mean it's normal. And so if your insulin is above 5 in a fasted state, and your glucose is above about 80, your body's having a hard time keeping your blood sugar where it needs to be. Like that's a problem. And so if you have too much glucose floating around your body, it's toxic. It hurts things. And so your body's like, I need to put you somewhere. So it makes all this extra insulin because insulin is what grabs onto glucose and shoves it somewhere, puts it in a closet, puts it somewhere so it's not causing issues. So insulin tries to take our blood sugar and store it in our skeletal muscle, our fat, and our liver. It just wants it out of the bloodstream because it causes problems. It causes you to have, when your insulin's too high, you're going to be hungry. It's going to cause you to get tired, but it damages things in your body too. This is why people get neuropathy. This is why you get cardiovascular disease, things like that. And so when your insulin is high and you have too much of it, it's inflammatory. Your body doesn't like it. It's like, And so the insulin will also cause issues in your gut. And so immediately your gut will become, a lot of times what it does is it makes your gut leaky. So all this inflammation in your gut is going to cause the cells in your gut to start separating. And when the cells in your gut start separating, when you eat food, that food's going to leave your gut and go into your bloodstream and cause more inflammation. So now we've got this big, the other thing insulin does with your gut is it's going to change the bacteria in your gut. If you have too high of insulin, too high of glucose, you're going to get bad bacteria that grow, because the bacteria that are supposed to be there, that are having a symbiotic relationship with us and keeping us well, don't eat sugar. They eat fiber. And so if you've got all this extra glucose and sugar floating around, the bad bacteria that aren't supposed to be there overgrow. And we get things like yeast, and we get things like, SIBO and different things like that. And so it is all very connected. And then your adrenal gland, your adrenal gland is just there to provide you with energy, right? Your cortisol is so important. Now it makes other hormones. It makes testosterone. It makes renin, aldosterone, other things. It helps with our blood pressure. But in general, our adrenal gland is supposed to give us cortisol so that we have the energy to get through our day, so that, we have all the energy to make our hormones, to stand up, to do all the things we need to do. Well, when your adrenal gland is constantly pumping out energy because you're nonstop on the go, or your body thinks you're dying because your insulin's high, right? When your insulin's high, your body's like, what's wrong? Oh my gosh. Your body goes on alert. So then you're going to have more cortisol production. Well, when your adrenal gland does this for years and it never gets a break, it finally is like, I'm done. Like, I can't do this anymore. And then you're not getting the cortisol that you needed, but you're also not getting the other important things your adrenal gland makes, like DHEA, like testosterone, things like that, renin, aldosterone. And so then people get dizzy, they don't feel well. And so it's so connected. And then we haven't even really touched on thyroid, but when your insulin's high and you're not making enough cortisol and your gut is leaky, your gut is really important for things like iron, vitamin D, B12, iodine. All these things have to be absorbed from your gut. These are essential micronutrients that your thyroid needs to even work. So let's say your thyroid is working. Let's say you somehow have a miraculous thyroid that works, even though your adrenal gland isn't working and your gut's inflamed and your insulin's high. If you don't have iron being absorbed from your gut because H. pylori is eating it from all your stress, or because you have leaky gut, your iron is very important for your thyroid to even be able to make T3 and to take T3 into the cell, which is your active thyroid hormone. So if we've got gut issues, even if our thyroid's working, it might not be able to do what it's supposed to do, because we have these important micronutrients that are needed for our thyroid to actually function. And when we have inflammation systemically, our body cannot take the thyroid hormone that we make in the form of T3 and convert it to active thyroid hormone, which is T3. T4. Our body makes T4 and we're supposed to convert it to T3. That happens outside the thyroid in the bloodstream as it's needed. So basically your thyroid hormone goes up to a cell in the form of T4. And if that cell, let's say it's my hair cell, if it needs thyroid hormone to help my hair grow, then the T4 is supposed to convert to T3. And the T3 is supposed to go into the cell with the help of iron and iodine and other micronutrients. And then that T3 is in the cell and is utilized. But if your insulin's high and you have leaky gut and you're inflamed and you have, all these other, you're stressed, that conversion of T4 to T3 can't happen as efficiently. And so those conversions don't happen. So then the cell doesn't get the thyroid hormone that it needs. And so this is why so many people feel so terrible, because once you have one thing that goes wrong, whether it be your insulin or your cortisol or your gut, it's going to affect your thyroid. It's going to affect your hormones. And then your hormones and your thyroid also affect your gut. So when your thyroid's not working correctly and your estrogen, testosterone, progesterone are not working correctly, that also affects your gut. So it's this big cycle. And then all those things affect your sleep. And then all those things affect your mood. And then all those things affect whether you want to get up and go to the gym. And so to think that you can literally compartmentalize someone as a doctor and just focus on one thing and actually make them better is completely ridiculous, in my opinion.
Yes, I couldn't agree more. And sometimes I look at the state of our health and what we're putting into our bodies, what we're suscepting our bodies to, our culture, our hustle culture, our food system. I mean, our lack of sleep, the lighting. Like, I look at all of it and I'm like, how are we humans even still alive? I mean, there's a lot of resilience in our bodies when you stop and think about all of the intricacies that you were just talking about, and how people have no idea what's happening at the cellular level every single second and how things, and then you think like we started to talk a little bit about fertility and you wonder why we have such a huge fertility issue and given no guidance as to why, like what's happening hormonally. We're just, sent to a fertility specialist and maybe given medications to help, with our menstrual cycle and maybe go, given hormones beyond that. But let's dive into that a little bit deeper because I have talked about this on the podcast again, like kind of surface level, but you alluded to, high cortisol really just tanking the DHEA and really the sex hormones in general. And it's like looking back, that's what happened to my daughter. Like her cortisol just went sky high, and all of a sudden she stopped getting her period. We did a Dutch test, her low progesterone, low estrogen, like everything, and cortisol like high. And she's like, "Well, mom, I don't feel stressed all that. I don't feel that stressed." I'm like, "Okay, but your body's perceiving a lot of stress." So yeah, what's happening with our fertility? Like why are our hormones tanking, and why is it so hard for young women? And I shouldn't say all of them, but there's just higher infertility issue or infertility rates than ever.
Yeah, I'm glad you asked this question. So actually in 2022, the United States hit a all-time low in fertility. So you can look it up. But our fertility was kind of going up and then it started to come down. 2022, it was like scary. And then it got even lower in 2023. It kind of leveled out in 2024, but it's definitely not going back where it needs to go. And so I actually I have several chapters about this in my book that's coming out where I talk about how your gut just is very in tune with hormones and fertility. But I think the issue that we have, it's multifactorial. It's people have thyroid issues, people have gut issues, people have insulin issues, and all of the people have cortisol issues. And all your hormones, like you said a great word at the beginning of the podcast, symphony. Like maybe this is what I should call my book, The Hormone Symphony. I don't know. But they work so in tune. And to your point, when you said your daughter's cortisol is high, immediately when somebody's cortisol is high, I already know if your cortisol is high, your progesterone is going to be low. When your progesterone's low, you're going to have poor sleep and your mood's going to be crazy. You're going to have really bad PMS symptoms. And then once your progesterone goes down, that further affects your gut. So I explain this in the book too. Like progesterone is so important for your gut. So just the fact that your daughter was stressed and her cortisol went up, that is going to ripple into her progesterone is low, which is going to ripple into her testosterone is going to get low too because her cortisol, she can't make testosterone and cortisol at the same time. So her adrenal is going to stop. Her ovaries are going to kind of stop making the testosterone as well because her cortisol is high. Her body's perceiving that something's wrong. So it shuts down her ability to reproduce, meaning she's not going to make estrogen. She's not going to make testosterone. She doesn't have progesterone. Immediately, her gut is going to take a hit because all of those hormones are very important for the good bacteria in your gut to keep working. So now her gut is starting to be leaky. And at the same time, all those hormones are very important for your insulin. So your insulin's going to shoot up, which is going to cause you to retain water and gain weight. It's going to make your mood worse. It's going to make your gut worse. It's going to make your estrogen worse. It's going to make your sleep worse. And then all of these things are causing inflammation. Now her thyroid's going to start, her thyroid's going to be like, well, I can't even convert to T3. I don't have anything I need to. And so then it's just this big, nasty cycle. And your body is made, like you said, to be resilient. And so what it's going to do is if you wake up in the morning, you have 100 units of energy, and that's all the energy you have for the day. It's definitely not thinking, let's waste 100 units of energy on reproduction when you've got all of those issues, right? It's like, well, I just got to figure out why we're dying, or I got to figure out how to make sure that we're fed. And so we just get into these positions where it's just little things can throw it off, but then it's a cascade if you don't get it fixed. And we live in this society, you said it too, where it's like, go, 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 go. And so we don't live in a society that helps you at all. So it would be one thing if your daughter went to college and she was a little stressed because she didn't have you, but she had counselors she could talk to. There weren't bright lights. We were expected to go to bed at 9 o'clock and wake up. There was none of this like life conducive of like the hustle culture. It was like, it's expected that you be in bed at 9. It's expected that you wake up at 6 and go to the gym. It's, it's all about like community. If you need help, let's help each other. It's not like that. And so your body gets stressed. She's in this situation. And then she's also made to think, I need to do more and more and more and more and more. And it's never enough and it's never good enough. So then we just continue to have these issues with our hormones, I think.
Yes. Yeah. And I mean, we're using my daughter as an example, but this is just
Anyone.
the world. Yeah. The world that we live in. And as we said, we're just not getting the help that we need. So I'm so excited for your book to come out, which we can talk about in a few minutes here. But okay, so we know we have major hormone issues going on. Our culture
Yeah.
isn't helpful. Going to our traditional doctors can be helpful. But a lot of times they're like we talked about, they're not trained to treat root cause. They're trained to treat symptoms. And then you start stacking medications and they start interacting, and we just get on this bizarre, road of not knowing what is the root cause. So, where do we start? Like, what do we do? What do we do? Like, where do you start with somebody? Like, if we could give them like 3 main things of where to get started with, if somebody's feeling like they're in one of these both here, like what we've been talking about.
Yeah, I think that's a really hard question. I
Yes,
think
it is.
that you have to be your own best advocate. So listening to things like this podcast, getting some good information, listen to your podcast, trying to understand and get good books and good resources. If you would have told me a year ago that I would have written a book, I would have told you you were completely insane. I'm actually like somewhat dyslexic, and it was really hard for me to get through school. And so to write a book is even. But the only reason that I've done it or agreed to do it, and I still hate it, even though I'm almost done, is because people need this information, right? And it's been one of the hardest things I've ever done, actually. And thank God for the ability to talk and have things right for you, et cetera, because I could have never sat there and typed it. But it's just because people need the information. So you've got to find somewhere to get some good information. But I also tell people, use your intuition in your gut. If you really if everyone listening to this found 30 minutes to set somewhere in quiet, like nothing, set somewhere in quiet and really just think about, how do you feel? How do I feel? How do I feel it? Like, do I hurt? Am I hungry? Am I tired? Just your body will tell you the answers, right? It will. Whether you're tired, whether you're working too hard. You just have to ask yourself. And so most people just never even take the time to sit down and say well, how do I really feel? They just get used to it. But I think, being intuitive is very important, but it's just very basic things, right? You have to sleep. And I don't care what anyone tells you, you need 7 to 8 hours of sleep as an adult. If people say that you need 4 or 5 and you can sleep when you die, you should immediately unfollow them and discredit everything that they say, because they're a complete idiot. There's tons of literature that shows you need sleep. I don't care who you are. And you need to sleep in a circadian rhythm. And you ideally, if you are sleeping in a normal circadian rhythm, you need to be asleep by about 10 or 11 o'clock, because you make excessive amounts of growth hormone between 11 and 1 a.m., 11 and 2. These are like your golden hours of sleep. Okay. Not negotiable. You need to be asleep in, a deeper sleep by 11 o'clock, because these are very important hours of sleep where you're making growth hormone and you're making your hormones for the next day. And you need to do this consistently, because what that does to your body is gives your body this time that it knows, hey, I'm going to relax. I'm going to get some time to recover and relax. So if you're listening to this and you're a parent, because I have parents, I'm not lucky enough to be a parent at this point, but I have parents who tell me this all the time. I cannot wait till bedtime. Because when I have bedtime, then I know at least I get a second, right? Once I put my kids to bed, then it's I get a second to breathe and I get a second to do what I need to do. Your body is the exact same way. Can you please go to bed so I can get things situated for the next day? And so I think one of the things is sleep. That's easy. Anyone can do this. This is free. You just have to do it. You have to set the time and you have to do it. So I think sleep is so powerful, and just changing someone's sleep, that will start to change your hormones. It'll start to change your gut. It'll start to change your mood. You will get rid of cortisol. So that is easy. Number one. Number two is sunlight. And if you can do sunlight with movement, I mean, so just seeing the sun in the morning when the sun comes up and when it goes down is so powerful. It does so many things for you. And that's free too. Now, if you live somewhere where technically there's not sun, I get it, it's hard, but at least go outside and get some sun and move your body because your body was meant to see that sun. It helps your circadian rhythm, it's going to help your sleep. These are things that you can do. And then food is so controversial and people get upset about this and what should you eat and what should you not eat? And it's expensive to eat well. In general, though, you can eat food that is ideally not processed or packaged. If you can, make sure you're drinking enough water. I mean, these are easier things to do as well, right? So just the nutrition, the things that you choose to put in your body, the things that you choose to fuel your body with. I mean, these are pretty basic, simple things that you can do that can really turn things around. Now, the other thing is your mind, your headspace. That's something again that's completely free. Food is not, but your mindset is. And so I I don't remember who said it, but somebody is known for saying that, you can never change what happens to you, right? So you never know what's going to happen in a day. I'm a doctor, you know this, taking care of people, you never know what they're going to say. You never know what you're going to walk into. But what you do have the ability to do is to pause, to reflect on it, and then to determine how you react to that situation. And it's the same thing with your brain and your body. Like, no matter what is going on in your life, doesn't matter, because I've had bad days too. You have the ability to set, pause, think about it, and then have a positive mindset about it. Instead of spiraling and being out of control, you have that ability to set and reflect and try to, be positive and then figure out what to do. I mean, these are all things that are very free and they may sound foo-foo, but they're really powerful because you can calm your body down. Like you can, if you've ever been very upset, your heart's been beating, you've been upset and you set and you're very quiet and you just breathe, like breathing, you can turn on your parasympathetic system with breathing. When you do that, you're going to lower your cortisol, right? You're going to lower your heart rate. So these are simple things. And so it's just finding these things that you can do without even going to your doctor. Now, you do need a good provider. You need to find someone like you, somebody like me. It's becoming easier because there's more of us, but those are things you can do without even doing blood work that are going to give you a lot of benefit, like a ton of benefit.
Yes. Yes. And people really crave this information, the simplicity of it. Like, why, like bringing these complicated medical issues and just simplifying, like go outside in the morning, eat real food, eat food that's growing in your environment, go to sleep by 10 p.m. Like these are simple, free things. And I just did a podcast a couple of weeks ago. It was a solo episode, but it was like going to sleep, getting 8 hours of sleep, but going to sleep by 10 p.m., circadian sleeping versus going to sleep at 2 a.m. and sleeping until 10 a.m. and how it differs. I mean, you're getting 8 hours of sleep, but hormonally, so many different changes. And like you said, there's leptin download, there's growth hormone, I do the same thing. I call on my podcast, call it the golden hours, like of 10 to 2, like you gotta be sleeping. And then you're sleeping till 10 a.m. You're missing sunrise, you're missing UVA rise, you're missing, you're sleeping through that cortisol surge in the morning, that normal one. It's just like, and so your body's hormones, they're firing at all wrong times and not, your body's just like not picking up those light frequencies to tell your body what to do. And so everything's thrown off.
The cool thing about that too, because I heard your podcast, but the cool thing is like, I was the person in my, as a teenager in my 20s, even in my 30s, where like I would set 2 alarms because I was always terrified I would sleep through one and like miss class. And like, I'm not even joking. I've asked my therapist about this. I still have dreams currently. Like I had one last week that I sleep through an alarm and miss a final in college and fail a class and don't graduate medical school. I still have that dream. I've been out of medical school now for 13 years, 14 years. I still have that dream, you guys. And I was so bad with like alarms and sleeping and like, but when you get your body right, like I sleep at the same time now, no matter what time zone I'm like, I don't even set alarms anymore. Neither does my husband. And it's just weird. Like I kind of joke with him. I'm like, one day we're going to really screw ourselves because we're just not going to wake up and like, but I just wake up. Like I go to bed about 9:30 and I wake up about 5, anywhere from 5:15 to 6. And I used to get really upset about it. And like, no, I have to be up at 5:15 because I have to be at the gym at 5:30 because I just let my body kind of tell me when it's ready to get up. And then I adjust my workout accordingly. And I feel so good. Like, and I never go to bed with this, like, oh my gosh, am I going to wake up? Am I going to, and so when you do these things to your body, it's pretty cool how your body adjusts. And it's like, it knows, right? It knows it's time to go to sleep. I don't lay in bed and toss and turn. I used to lay in bed and toss and turn. It would take me an hour to go to sleep. And I get in bed. My ring says I'm usually asleep within 7 to 10 minutes. And then I wake up between 5:15 and 6:05 every single day.
Mm-hmm.
Like it's pretty cool, right? Like your body just does it.
Mm-hmm. Yes, you just have to let it. You just have to give it a chance.
Yeah.
As we close out, I want to go through a little bit of a case study with you. I've never really done this on the podcast, but I really believe this is like God's intervention. Like I knew I was interviewing you later this week, and I had a long-term client that I've been working with and started with pretty severe insulin resistance. And, we worked a lot on weight loss and a lot on her life and her lifestyle. And she had hyper Graves disease when I started working with her, or had been diagnosed several years ago. And over the winter, she's like, Shana, I don't know I don't know what to do. Like I've gained 18 pounds. I haven't changed anything. Like we shifted her eating back. We did some circadian stuff. All of a sudden I'm gaining 18 pounds. I'm like, well, this doesn't make sense. It has to be hormonal. Like get your thyroid check, get all your thyroid numbers checked, get your leptin checks. I want to make sure your leptin isn't too low or too high. Her leptin came back beautiful. It's like 7.5. And she got her TSH. Of course, this is like, she got her TSH and one other thyroid hormone checked. I'm like, ask for more. You need all of them and get your TPO checked. And her TPO came back at 147. I was like, oh my goodness, like you have Hashimoto's. And I said, I'm not a thyroid expert. I'm not going to claim to be, but from what I know, like you want those close to zero or at least under like 15. And so anyway, I just want to read you. And again, we're not here to like bash conventional medicine, but this is what patients are dealing with and the frustration that they're feeling. So her TPO is 147. So you can speak on that a little bit, but very, very high. And her practitioner said, you're positive for Hashimoto's. There's nothing we can do to bring this level down. This is the cause of thyroid issues. And my client said, well, what do I do? And she was told, you are already being treated with methimazole, which I think is that the one that you were?
Methimazole.
There's nothing we can do to bring your TPO level down. Your level's actually on the low end. We treat the TSH, which again, we are doing. Your last levels were great. So I suspect the thyroid is not causing the issues you are experiencing. Thyroid-like symptoms can correlate with a lot of other issues that may be happening. And that's where she was left. And then she turned to me, she's like, what do I do? And so she's looking for a new primary care physician. But okay, so let's break this down, like the antibodies and what people should do.
Yeah. And unfortunately, that's the rule and not the exception. And what we need to do is change that in this country. And that needs to be exception and not the rule. So there's a lot of stuff that she can do actually. And, so her TPO antibody is high. So she is predisposed to not only when she's done with Graves, but she's going to develop Hashis. And the problem with Graves, and a lot of people don't understand this, the methimazole that she's taking, it's blocking her body's ability to make thyroid hormone. But it's almost like you have to do like a break gas at the same time. Sometimes you even, and this is going to sound crazy, and I'm going to get all the hate from traditional medicine. Sometimes you have to block their thyroid with methimazole and give them back thyroid hormone at the same time, because you can't just let them go and be hyper, but you can't block it. Like when you block their thyroid with the methimazole, she's not making as much T4, but the T4 that she is making that's supposed to make her feel normal, again, it can't convert to T3 in the periphery because she has all this inflammation. And I know she does because she's gained weight and her TPO is high, right? And so her TPO is high, and this Graves that she has developed and is being treated for has affected her adrenal. So I guarantee you, if you look at her cortisol, it's either sky high or it's low. She's either on the roller coaster up still, or she's adrenally fatigued now and she's low. I guarantee you that her hormones are out of whack. Her testosterone is probably low. Her insulin is most likely high. And I mean, you can answer, but she may have some gut symptoms as well because of all of this. And so her body is in no way going to let her lose weight at all. I don't care what you do with her until you calm down some of these hormone fluctuations and imbalances in her body. And it does start with her thyroid. So unfortunately, that doctor has no idea what they're talking about. And she does need some thyroid support. Now, you can do it with things besides medications, right? So in her particularly, I guarantee you they checked her TSH and maybe they checked her T4. And nobody looked at her T3, which is actually the most important thing that you need. And so I guarantee you if they looked at her T3, it's in the toilet. It's very low. And the blood test of a T3 is not even that important. It is, but what I'll tell you is we don't have a way to check and see what T3 is actually in the cell. If somebody figures that out, my God, it'll be miraculous. Then all of you people walking around with symptoms will be validated. I believe you and I hear you, but it will be very validating to see that although you have T3 in your blood, it's not in your cells. Like it's not getting in there because you don't have the things to pull it in. If you checked her T3, I guarantee you it's low. And so in her, what we've got to do is figure out a conducive way to fix her environment with all this inflammation so that her T3 can actually come into her cell so that we can start lowering her insulin. We can get her hormone production back up. We can get her cortisol to go down. We can get her leaky gut fixed because of all the other things that are going on. Not that she's eating poorly, but that everything else that's going on. Make sure she's sleeping well. So it's a multifaceted approach in her. There are things that help too, though. LDN, low dose naltrexone, will just help. It's not a fix all be all forever. It is sort of a band-aid type approach, but it's a band-aid type approach to help calm everything down. If her insulin's high, she would be great for a microdosed GLP-1. She would be fabulous for a microdosed GLP-1 because it would help with all of this inflammation she has in her thyroid and her adrenal and her gut and her hormones. So, I mean, in her, she's just got a lot of different things going on. And unfortunately, she's got a provider that has no idea what they're talking about. And the sad thing is, it could even be an endocrinologist because in school, they teach endocrinologists you treat hyperthyroidism with methimazole. It doesn't matter. You calm them down. And then they go from hyper to hypo symptoms. That's fine. You put them in remission. And then, it doesn't matter. Like they teach you that the symptoms don't matter, but they do matter because those symptoms are causing her to have all these other issues. So in her in particular, she may be somebody who not only needs methimazole, but needs a little bit of T3, either in the form of NP thyroid or Cytomel, liothyronine, something like that, so that her cells actually have the energy to do the things they're supposed to. And then we need to look at her adrenals and we need to look at her gut and we need to look at her hormones and we need to make sure and her insulin. And we need to make sure that we are supporting all of those things so that we can support her through this thyroid issue. And then everything kind of heals together. Does that make sense?
Yes, definitely. And we did, I know she's had extensive lab work done and she sent it all to me. And I just kept saying, nope, you needed to get this too, and this too, and this too. And even what's now she's trying to find somebody because this was an endocrinologist that pushed her back to PCP. Now she's trying to find a specialist who can actually help her. I said, well, at least you have lab work done. Like that can get really expensive. But at least when you find somebody, a different practitioner to work with, at least you have your lab work there. Okay.
And
So
that's autoimmune. That's autoimmune. Like anyone, your son, me, everyone, like that's what happens, right? Is like that provider she's seeing is looking at one thing. And the problem is that one thing is influenced by her adrenal and her gut and her hormones. And, it's not just one thing. And that's what we have to get people to realize.
It's not just
not one thing. Because if you just focus on that one thing, she's still going to feel bad. And it's kind of like, what they did to her? They put her in a rowboat and they kicked her off the shore of New York and they said, row to England. Like that's what they did. They did, I mean, that's not fair. Instead of giving her a giant yacht with like motors and all the things to get her there. I mean, if you're just looking at her thyroid, like it's going to be really hard. Like she's going to be rowing for a while.
And the other thing that makes me really sad, like she's a school teacher. She's not trained in hormones.
Right.
It's like, she's found some good people to follow and podcasts to listen to, but, she's just thinking she should listen to what she's told and she has, and it hasn't really been helpful. But last question, and then we'll wrap up because I want to talk about your programs in your book a little bit. But you mentioned microdose GLP-1s. I did want to make sure you're an endocrinologist and you studied those very extensively. I want to just ask your opinion on those. We're not here to like say everybody should take a GLP-1 or nobody should take a GLP-1. But talk to us especially about the microdosing and, what your thoughts are with this peptide.
Yeah. So I think this is one of the most powerful drugs I have ever seen. They are so amazing when used correctly. And so to your point, it is a peptide. So GLP-1 is something your body naturally makes. We're born with it. Okay. So we are born with GLP-1. And then over time, as we age, by decisions that we make, we lose it. So when you eat too much and your body says no, and you keep eating, your body's like, fine, I'm not going to keep making it. Right. So there are just things that we do over time where we lose this GLP-1. And this is what I tell patients all the time. If you ever notice kids, right? 2-year-olds, 3-year-olds, 4-year-olds, if you set them down and you give them a plate, they're going to eat. When they get full, they're going to get up. Like, it doesn't matter what's in front of them. It doesn't matter if it's their favorite snack. It doesn't matter if they've cried for it for 10 minutes. They might eat 3 bites of it and then they're going to get up because they have functioning GLP-1. When their body says I'm full, they're done. So the worst thing you can do as a parent is force them to eat when they're not hungry, because that's going to decrease the amount of GLP-1 that they have in their body. GLP-1 is so potent. It helps you know when you're full. It helps your body make insulin efficiently. It helps so many things. There are receptors in our heart, our kidney. We don't even understand all the places that there are GLP-1 receptors, but it is a very powerful, potent hormone that we naturally have. Now, pharmaceutical companies figured this out. They've made drugs, lots of them, that are GLP-1 receptor agonists. Okay. There's a lot of misinformation, I think, about these drugs. There's a lot of people who say, they're the most terrible things ever. It depends on the dose that you're using. It depends on how you're using it, for what reason, timing. There's so many things. So to put it in a box and just say they are terrible is not fair. I used them as an endocrinologist to treat diabetes. They did amazing things for diabetes. I had people lose 100 pounds. Their A1Cs went from 12 to 6. It changed their life. I'm not going to give that same drug in that same dose to somebody like you or I, or somebody like your patient who doesn't have diabetes. What I will say about these drugs, and I do a lot of labs, okay? I have never seen a drug be able to lower insulin, be able to lower CRP levels, be able to take pain away. Like, I have these drugs, and I'm not talking about big doses. I'm talking about tiny doses. 99% of the people I put on these medicines tell me, I don't feel anything from that medicine. Did you even give me anything in that medicine? But they're kind of joking because they're like, but my joint pain is better, but I have lost weight, but I'm sleeping. But I saw a guy this week, his CRP about 6 weeks ago, CRP, this is a young guy. He had low testosterone. His CRP was 8.6. That's not good, right? You want your CRP to be less than 1. He had high insulin. His insulin was about 13. His CRP was 8.6. His testosterone was about 300. We talked about everything I just told you: exercise, sleep, all the things. I gave him a little bit of Clomid because he's young and his FSH was low. And his FSH, which is what tells your body to make testosterone, was low because he's so inflamed from his insulin and his stress. I gave him Clomid and a microdose of GLP-1, and that's it. And I said, I want to see you in 6 weeks. That's all I did. He came back this week. His CRP was 0.6.
Wow.
0.6 to 0.6. And his testosterone was 900.
Wow.
That was it. That's all I did. I didn't and so these drugs are so powerful. And he said to me, I feel amazing. I don't know. He's like, I don't even know what's in this shot, and I love it when people say that, like, they just trust you. Let me just inject myself with this. I have no questions. Jesus. I don't even know what's in this shot. I don't feel any different other than I don't hurt. I'm less hungry. I've lost weight and I feel amazing, And so it's like, these drugs are very powerful, but you have to be careful because you have to understand how they work with other things, right? You have to understand what you're doing with them. And you can't just give them to people and give them no education, right? So you have to tell them we need to eat our protein. We need to prioritize protein. Yes, they can cause constipation if you don't drink water. Sometimes you don't drink water when you're not hungry. When you're not hungry, you're not thirsty. So you've got to monitor your water. And when you do eat, we've got to prioritize protein and we need fiber. We need to also sleep. I mean, you've got to educate people. They're not like a magic pill. But when used correctly, they change people's lives. And they do it because they lower insulin. And we talked about this. Your insulin is like the cause of all of inflammation. So when your insulin's high, your your adrenal gland is going to not work well. You're not going to make hormones. Your thyroid's going to stop working as well. Your gut will not work as well. And so it goes to like the root cause of it and starts to calm everything down. So in my professional opinion, I have used these drugs in thousands of people. I have had very few, if any, complications if it's done correctly. And they are wonderful, wonderful additions to lifestyle modification and helping people. And I will also say, the other thing I hear from people is like, well, once I get on this, I can never get off of this. I have a patient who has been on a tiny dose of it she was on a tiny dose of it for about 6 months. She lost 40 pounds. She's been off for 2 months. She has not gained a single pound back. I had another patient who was on a tiny dose for about a year, lost 110 pounds, has not been on it for 2 months and hasn't gained a single pound back. So that's not true if you're fixing everything else. Does that make sense?
And the dosing, like I think the dosing is just
so important.
And I've anybody I bring on here who's a hormone specialist, I ask about GLP-1, and that was probably the best way to explain GLP-1s that anybody's explained it. So I'm so glad that I asked you about it. One more question on GLP-1. So if there's somebody, say they're like 50 and they're type 2 diabetic and they're, like their hormones are whacked out, severe insulin resistance if you're to the type 2 diabetes stage, and like say we microdose GLP-1. Now, can that hormone like naturally work its way back up? Or is it kind of where like the point of no return, where it's been shot for so long and it's, you've overeaten your whole life, you've eaten no protein, no fiber, like, can you bring that back up naturally? Because I've seen where like if you do start eating very healthfully and you're eating a lot of fiber and you're protein centric, you start strength training, you sleep, you can boost it naturally. But I would think that there might be like people with really severe insulin resistance and metabolic issues that it's not going to be as helpful as with somebody who's been more healthy, if that makes sense.
Yeah, that's a good question. So it's going to depend on the person. So assuming your pancreas is functioning to some degree, then yes, you can restore some of your GLP-1. So if you've had your pancreas removed, no, you're not going to make GLP-1. If you've had significant pancreatitis from whatever, alcohol, gallstones, medication, whatever, and your pancreas, literally the cells in your pancreas are destroyed, then no, you're not going to be able to make that hormone. But if you have significant insulin resistance, but you still have function of your pancreas, which you can tell by blood tests, you can check C-peptides and things like that, then yes, you can restore your body's ability to make some GLP-1. It's the same thing with your thyroid. When your body is inflamed from high insulin, from high cortisol, from no hormones, from high glucose, from a bad gut, then your pancreas is not going to waste those 100 molecules of energy trying to fix a cell to restore GLP-1. It's just trying to get you through the day, bare minimum, right? Like, what do we got to do to make this person be able to breathe, poop, eat, and get to sleep again? Like, so yes, it can be fixed. That's where it goes back to like fixing your whole body. And so I think that's what happens in my patients. I don't use very much, but we are so focused on like, we look at everything with them. We look at their sleep, their relationships, their nutrition, their movement, their light therapy, their micronutrients, their cell membranes, their hormones. Like, we're so dialed into fixing everything. Your body is so resilient. Like, it will fix itself if at all possible. So if you have a working pancreas and you do the things that you need to start letting your body heal yourself, then yes, you can make more GLP-1 and you cannot need it. But I think the problem is a lot of people just dose it. They give it to somebody. They say, start here and go up every week until eternity, until you can't eat anything and you're constipated. And then people lose a lot of weight, but they lose muscle, which is also not what we do. We make people do in body scans every 4 weeks. And if they start losing muscle, we take it away. So like you have to eat your protein. If you do it correctly and you keep your muscle and you lose fat and you're not, taking large doses, then your body will heal itself and repair itself and you will make more GLP-1 again. So you can, and again, it's the environment.
Yeah.
That
Get
you're,
the inflammation out of the way. Yeah.
yes, it's the environment 100%. It's just like asking, it's like asking if you go into a teenager's bedroom and everything that they own is on the floor. Like they don't have anything in their dresser, anything in their closet, their bed's not made, you can't even see the floor. And you ask that teenager to, do something productive in that room, they're not going to be able to do that until they clean everything up, right? Like this environment is not conducive to doing anything productive. Same thing with your body. When your body is a wreck like that, it's not going to clean itself up. It's not going to fix anything, and you're not going to function well. And so you have to get rid of all that inflammation. And then yes, your body will. I mean, I have seen people. I could cry telling you stories about people that I have seen come in and they're just like they've given up. I've almost given up. Like I've had people who can't walk, who haven't been out of bed in years. I have a girl who literally didn't get out of bed for over a year. She quit college. She basically like wanted to die, was like suicidal, and she comes to my clinic now, like walks in my clinic and is going back to college. Like pretty cool.
Yeah. Yeah. We're so resilient. We just gotta get our own inflammation out of the way and let our bodies take over naturally. Well, this is a delightful conversation. I'm so glad I brought you on. Tell us where we can work with you and about your book coming on. I know when I last spoke with you, you were still toying with the title. Are you still there?
Yes, I still am kind of. I think I'm almost there. But yes,
Okay.
I have a book and it's been a labor of love. And if I have a whole new respect for people who write books, by the way, because it doesn't seem like it's that hard, but it's really hard. So basically the concept of the book is just to teach you everything that we've talked about, because I feel like people don't understand. So I really try to break down in the book how every single hormone in your body all relates back to your gut and how they work together. And then once I give you that framework, I teach you simple ways to fix your gut. And I also kind of break it down by category. So like I have a whole category on PCOS and why birth control is not the answer and how we fix it. I have a whole category on infertility and a whole, category of menopause and just different things like that. And I have at the end just some ways that you can, do some gut testing yourself and learn some things. And then at the very end, I try to tie it all together just about what we talked about. Like here are 10 steps that you can do that are completely free for your body just to start healing. So that's kind of the concept of the book. Is I just want people to have this information and be able to go back to it and reference it. And so that's why I wrote the book. The title has been up in the air. I had a title that I really liked, but it is trademarked, not for a book title, but for something else. And so my attorneys are telling me, well, they could sue you. They probably won't, but so yada, yada. So anyways, I'm probably overthinking the title, but I don't have the title yet. So hopefully the book's going to come out in the next 3 to 4 months. It's pretty well ready. Just trying to finalize the title, but I'm really excited. I've had a few people read it and I'll love to send you a copy of it too, who have had a lot of nice things to say about it. So I'm excited about that. If you want to work with Modern Endocrine, we actually have a license in 42 states, I believe now. And by the end of the year, it'll be all 50. So unfortunately, California and New York are like pulling teeth. So I've been working on that for like 6 months. So I hear you, California and New York. I'm trying. But it's interesting. South Carolina too. I don't know why South Carolina is so difficult, but it will be all 50 states by the end of the year. If you just want to go to our website, it's www.modern-endocrine.com. We have a map on there that tells you you're welcome to call us. And then I'm really active on social media. It's just at Modern Endocrine. I do a lot of webinars. I try to give you guys a lot of free information. If anything, go to my website and look at our free stuff. I try so hard to make all this free content for you. I have blogs and I have freebies, and it's just like downloadable PDFs about diet and sleep and all the things we've talked about. I give you tips on like how to do that. It's 100% free. Just go download that if anything. Because if you're sitting here thinking, well, I don't even know how to start a sleep routine. I don't even know how to start an exercise routine. I don't even know what a high fiber diet looks like. It is all on my website, 100% free. So go get it and start there.
Yeah. And you have a podcast.
I do. I have a podcast. It's called Hormones, Metabolism, and You. And I have wonderful people like you on there. And so I just try to educate people with that as well. I'm working on a course. I have an app that I actually made that's a gut health app. It's really cool. I want to give it to the world, but my health coach won't let me do it yet because she wants to make sure all the kinks are worked out. My patients have been using it for about 2 months and they love it. So that's coming. And then I'm working on some courses too. My true, like, my true goal in the next 5 years after this book, I want to make a course for people so that they can go through and they have something to show their doctors. But then I want to educate providers. I have people who ask me and I want to do it. And that's a big undertaking, but I'm going to do it and I'm going to provide it to people because I think there are people who want to be better. They just don't know how.
Right, right. Yes, I've had other dietitians ask me, and I said, yeah, that's a labor of love, maybe down the pipeline, like way down the
Yeah,
pipeline.
it is.
But yeah, and I've been trying to get licensed in New York myself, just for a doctor who I'm working with. But yeah, I'm like, is anybody there?
Yeah.
I don't
And
know.
then, yeah, I won't even tell you all that. Yeah, but it's crazy.
Yeah, lab work too. It's just like jumping
So
through
if
hoops.
anyone listening knows how to get a license in New York or California quicker, I'm all ears.
For
Um,
dietitians or doctors, let us know.
we're trying.
Oh gosh. Well, thanks again, Dr. Cassie. We learned a ton on this. I mean, I could put you through about 20 more interviews. But
Yeah.
at least we got a lot of great direction and start on some things. And I'm sure people who listen to this want to work with you and are anxiously waiting for your book. So thanks so much for coming on today.
Thanks for having me. And thank you for everything you do too. I've listened to your podcast. I know that you do great work. And, I know you've had a rough few years or so too, but just what you do is very important. So thank you for doing it. Hang in there. Keep
Thank
fighting
you.
the fight.
We will.